Welcome to Health Live at Seniors Today. We wish you all a very happy Ganesh Chaturthi. And today I'm going to start the session today is with a vanakkam. And the reason why I'm saying vanakkam is because our doctor today is from Chennai. And we have Dr. Nidhi Singh. A little about Dr. Nidhi Singh. Dr. Nidhi Singh is the Senior Consultant Department of Dermatology at the Gleneagles Hospital in Chennai. She has been actively involved in patient management with great passion and commitment. She has experience in independently managing various dermatological disorders, including emergencies and procedural dermatology. Her current area of interest is pediatric dermatology, dermatological diseases in women, dermoscopic images, and clinical dermatology. Dr. Singh has received several gold medals and certificates of honor in surgery, obstetrics, and gynecology, pathology, pediatrics, ENT, forensic medicine, pharmacology, physiology, and biochemistry. And this includes a best final year student in MBBS and the R. David Gold Medal and the Indian Association of Dermatology and Venereology Medal. We are indeed delighted to have Dr. Nidhi Singh here, and we have requested her to speak on skin health for seniors. Thank you, Dr. Singh, for being here. We've been doing our Health Live series since June of 2020, and we've discussed dermatology often, but we don't discuss it so often, though we keep receiving a lot of requests from our readers, from our attendees to discuss issues on dermatology. So I'm going to leave it to you for your presentation, and then we'll take questions from our attendees here today. Over to you, Doctor.
Thank you, sir. Good evening, everyone. And my sincere thanks to everyone to be present here, despite the puja celebrations around. And so starting with today's topic, skin health for seniors. I'll start with the outline of skin, its importance and structure, the skin care, common skin issues that we get, and a little bit about aging. Why is skin important? We all know the very important function of skin as such is protection from various injuries, infections, and how it also helps us regarding temperature regulation, the hot, cold. When it is very hot, we tend to sweat and we are maintaining our body temperature. For people who don't sweat well, then they find it very difficult. There are certain rare disorders where there are problems happening because of that. Skin as a sensory organ is of extreme importance. We are all aware about that, as the sensations reduces in certain diseases and we find it difficult. Then it's a storage of various nutrients and also helps in vitamin D formation and absorption function of skin. We as dermatologists utilize when we are using various medicines and ointment and cream formulations, and we ask that to be applied, and that is being utilized, that function of skin. And yes, it can excrete the toxins, and not to forget the immunosurveillance function, which is done by the skin. Our immune system, one of the immunosurveillance areas are also the skin, and then the mechanical function, and last but not the least, the cosmetic function. Now, skin is directly visible, and so at times it can help us in figuring out marker for something serious inside also. Now, skin is the largest organ of human body. Structurally, a simplified version is there are 3 layers. The topmost and the outermost layer is called epidermis, just underneath dermis, and then we have the subcutaneous fat or hypodermis. Now, coming on to skin care, a gentle cleansing is enough. Especially the water used should be just the normal cold usual water or lukewarm, not hot water, just short time, 5 to 10 minutes. Avoid vigorously scrubbing the skin, and scrub should not be used more than once a week, or if it is winter season and all, once in 2 weeks, but is not recommended for patients with sensitive skin or those who have already a very dry skin. So as we age, the skin starts getting dry, so we should be careful about it, and even fragile skin. Ideally, use a gentle cleanser or a mild soap, and In the body, area with body odor glands like armpits, groin, buttocks, feet, these areas require a daily cleansing, but other areas, if they are very dry, we can reduce the soap or cleanser application, just limit it to twice or thrice a week if the dryness is too much. As far as face is concerned, use a cleanser which is the mildest, that is doing its job. After a face wash, if we are feeling a tight, squeaky, clean feel, that is better to be avoided. So because too much of removal of natural oils may not be good in the long run. Now, immediately after the cleansing, there should be followed by a moisturizing. Moisturizing should ideally be done minimum twice a day. So one is immediately after toweling on the damp and moist skin, not wet skin, that is after bath. The other time we can do it after a wet toweling. So 2 times a day it can be done, especially on the body. Face, normally as we cleanse morning and night, it can be done 2 times, morning and night or morning and evening, whatever is comfortable for a person. But hands are washed many times in a day. And some of us have a schedule where we have to do frequent hand washing or use hand sanitizer frequently. In that case, the moisturizing should be done multiple times in a day. Then lips, they need coating almost throughout the day with a hydrating lip balm. It can be a plain white petroleum jelly, especially if one is outdoors or in dry indoor air. Now, night before sleeping, definitely we should look at the soles. At that point, examine the feet, that in between the toes, just check there are any wounds, cuts, and moisturize it off. The feet and toes, in between the toes, we also have to take care that they don't stay in very moist environment for long, prolonged periods, especially if we are wearing closed footwear for a long time. And in between the toes area should get some aeration so that infections do not develop or we pick them up early when we see. Now, after a gentle cleansing, moisturizing, and sunscreening forms a part of the skincare. Now, this is also the most important preventive anti-aging strategy. Ideally, at least an SPF 30 and above or PA3 plus and above sunscreen should be used 15 minutes before going out and reapply every 3 hours. Most sunscreens need reapplication every 3 hours. Apart from this, additional protective measures in terms of clothing, umbrellas, sunglasses, hats could also be used for better protection. Now, sunscreen, one problem is we all use very less sunscreen. Ideally, we need more than half a teaspoon of sunscreen just for the face and neck and each arm. Luckily, for most of us, leg, chest, and back sunscreening is not required, but for in whom it is exposed, they will need more than a teaspoon. Now, is sunscreen really necessary on cloudy days? Most of the time, white clouds, almost around 90% of the rays would shine through them, while only 30 to 35% rays will still shine even through dark gray clouds. So it actually makes sense to use sunscreen even outdoors. And the UV rays will be passing even through our car glass panes and home windows and all that. So we have to keep that also in mind. Now, coming on to nails. Yes, like skin, again, nutrition becomes a very important part for healthy nails. We should be wearing comfortable footwears. If closed footwear is being used with a narrow toe space, we have to see that it should not be very tight, that narrow toe space area. So any tight or ill-fitting footwear should be avoided. As we age, the nails go thick. So if there are thick nails, we should soak them for 30 minutes before cutting. Now, regarding trimming of the nail also, we should trim them straight. We should not do this curving at the margins. If we curve at the corners like this, after some time, there is a risk of going that ingrown toenails problem, especially in the great toenails. They become very painful at the corners. Like if we keep on cutting, after some time, the length also goes shortened and it starts growing in these corners. So we have to keep the length longer and cut it as straight as possible. Another important part in the nail is this area, which is just where this is skin, just where the nail starts. And there between the skin and nail, there is a sealant here, which is called cuticle. We should try and keep this area safe. Some people push it and try to cut it. Please do not do any such thing. If you feel it is dry and rough little bit, just apply a moisturizer. Remember to do that regularly so that it's preserved. If by chance a part of it is just torn off and coming up, never pull them out, because once we pull them off, more damage happens. So it can just be trimmed right where it is projecting, the dead area, if it is broken and damaged and projecting out. Now, what are common skin issues in seniors? Commonest being dry skin, then itching, skin infections, and various rashes. Now, they can be of a short duration or long duration, depending on the problems. The common ones being lot of you, many of you may have experienced hives or some insect bite or heat rash like prickly heat, or bruises is pretty common because as we age, one, the skin becomes fragile, and the other thing is many people may be on certain medications by your heart doctor regarding which actually will be increasing the bleeding tendency. So bruises are common. They come and they subside on their own in some time. Then there are lots of chronic skin diseases which may be causing the issues. Now coming to itching. Itching can be either localized, means specific to a particular area, or be their whole body. That is called generalized. Now coming to generalized causes of itching, one of the very common causes is dry skin, and we do not realize that. So gentle cleansing, moisturizing, regular moisturizing itself would actually help us a lot in that way. So if we are inculcating the very gentle cleansing and moisturizing as a part of our regular moisturizing, part of our daily routine, we can avoid the unnecessary problem. Now, the generalized itching could be because of some skin disease, or it could be because of some internal disease. That is systemic diseases, diabetes being the common. Whenever the diabetes control goes poor, people do start struggling. Or it could be due to thyroid disorders, some liver kidney issues, or a low hemoglobin, that is iron deficiency anemia specifically. Sometimes these kind of generalized itching could even be drug related. So we have to be careful and look into all the angles. And there are other causes which are far rarer. So these were the common ones. Now coming to common skin infections. Now skin infections, depending on the type of the organism causing it, it could be bacterial, fungal, viral, or infestations. Now bacterial are different kinds of boils. They can be small boils, big boils, ranging a variety. So in terminology wise, we call it folliculitis, furuncle, abscess, carbuncle, impetigo. Now, fungal infections, the usual ringworms, which a lot of people may have seen or experienced in their life. Ringworm, commonly in the private area sites, basically the body folds, or it can be in various parts of the body where occlusion is quite high. And then apart from that dermatophytosis, there are malassezia infections like tinea versicolor. There could be candida infections. Candida infections are also very common in diabetic patients. And then various nail fungal infections. These form of the usual common fungal infections. Viral, we all know about chickenpox, which comes in childhood. Now, the same chickenpox virus actually stays inside the body in certain nerve, dorsal root horn. And when we are not well later in life and our immunity is dropping, at that point, the virus reactivates from that area and moves to area of the skin supplied with that single nerve correspondingly. So we tend to get painful skin blisters in that area. And that should be picked up early because an early treatment can help prevent the later on the blister goes off and the pain stays for some people. That becomes a problem. And yes, not to forget the common tiny blisters that some people get around the lips and all some herpes simplex infections. Coming to infestation, head lice is a common thing which everyone knows. It can be picked up early and just treated off. Or sometimes scabies, which just presents with itching all over the body. Some areas are more severely itchy, and itching tends to increase in the evenings and nights, especially in between the fingers and thighs, private area, buttocks, or the whole abdomen back. The itching can be quite a lot. This is Just a short view, the ringworm infection, depending on the area it involves, the terminology keeps on varying. Like the private area folds, Tinea cruris, when it is on the body, say the waist area, which is quite common, especially occlusion site, the belt site or the lady's tie site. Tinea corporis, when on the face, fasciae or the beard, it can affect. It can even affect the feet, that is Tinea pedis. Now, what are the avoidance measures we can think in terms of skin infection? One is wearing loose cotton clothes, and better to dry the clothes in sunlight. And we keep our skin folds dry, avoid prolonged occlusion of our sides like waist or people sitting for very long hours, the buttocks, sometimes when they sweat a lot, it's a problem. And we keep our in between the toes area dry and aerated. For this, we have to specifically watch out for feet swelling. If someone has a feet swelling, please get it evaluated. There can be many reasons for the feet swelling. Sometimes, yes, there is a venous insufficiency. That means our veins in the legs, there is a problem. Sometimes there could be some kind of incompetence in the valves, which is causing that. So venous insufficiency, or there could be some internal other issues, liver, kidney, heart issues. Certain people have low protein, some have iron deficiency. So we have to figure out the cause, or some drugs may be causing the feet swelling. So we have to get it evaluated and do the measures to reduce the feet swelling. Because when there is a feet swelling, the in between the toe, the spaces get drastically reduced, and hardly any aeration happens. And when we go to bathroom, or if someone puts water on the feet, and once that area gets wet, we forget to dry it up. And staying like that, wet environment, not at all no air going in, it tends to catch infections very fast. And yes, not to forget, if someone has diabetes, a good diabetes control is a very important infection avoidance measure. And above all, if we do find a skin rash, an early identification or a suspicion of skin infection, we should go for a dermatologist visit so as to treat it early. I just wanted to specifically stress on this. This is what I was talking of, painful skin rash with blisters in a particular skin area. We call it dermatome, which is herpes zoster, or in simple term, shingles. Now, this should be picked up early. And if someone happens to have a suspicion of this, they should schedule an early dermatologist visit and take treatment so as to reduce the risk of post-herpetic neuralgia. Means when this rash settles off, sometimes the pain just continues. So that has to be, we can avoid that by an early treatment. Try to reduce the risk of post-herpetic neuralgia. Another thing is, now there is a vaccine also available for shingles. So you can talk to your doctor for that. Now, what about chronic skin diseases? Yes, they would need a good disease control and maintenance, and a regular dermatologist follow-up should be fine. How to manage in eczema-prone skin and sensitive skin? Please do not scrub your skin while cleansing. Gently pat your skin dry after a bath. And yes, the most important thing, moisturize the skin immediately after bath. Now, the kind of products that we use, we should not be using any products with fragrance, perfume, and also unscented, fragrance-free, dye-free to avoid irritation. One should avoid alcohol-based antibacterial cleansers, especially during flare-ups. Dyes, perfumes, fragrances, and detergents that are left on after washing and drying may also irritate the sensitive skin. So we have to avoid that, and preferably double rinse in the washing machine should be done for the clothes. Now, coming on to aging, it's a natural process, dynamic, progressive, and undesirable biological process that unfortunately cannot be stopped according to the present knowledge. Now, what we can do about is lifestyle changes. As I already said, sunscreen is one of the very important preventive measures. So avoiding sun exposure, or at least avoiding exposure in the peak time of the sunlight, that is between 10 to 3 years. Nutrition, taking a well-balanced diet, local, seasonal, close to traditional, and we stop once we are at least stop at around 80% full. Avoid processed, ultra-processed food as much as possible. So anything from the packet, that will be avoided. Staying hydrated. And yes, daily exercise, a good sleep, no smoking. People who smoke, they tend to have aging changes much, much faster. And if someone has any systemic disease or skin disease, an early diagnosis and good control, like good control of diabetes is very, very important. Otherwise, changes are. Apart from all these lifestyle changes, yes, there are a lot of anti-aging creams and various strategies and supplements. Yes, one can discuss with their dermatologist regularly. Now, healthy skin is a reflection of overall wellness and acceptance and awareness, along with a good skincare routine and a healthy lifestyle, can help in gracefully delaying the skin age. This is a documentary series. A lot of you may have already seen it, but if someone has not seen it, I request to just go through this. I found it very interesting. So, Live to 100 Secrets of the Blue Zone. Here, the author Dan Butner will be traveling around the world and going through and looking into the lives of people and figuring out what is the secret of their longevity. And finally, actually, he started with his journey of these 5 blue zones. That is from Okinawa in Japan to Sardinia in Italy, then Icaria in Greece to Loma Linda in California, and then finally Nicoya Peninsula in Costa Rica. And he was discussing all the lifestyles and what the possible reasons of people outliving. Actually, what is these are these blue zones now? They people live the highest concentration of centenarians, people above 100 years. So that is why they were looking into that, and they were trying out what all could be the reasons. So what were the longevity lessons he got from the blue zone? They move naturally throughout the day. They have and cultivate a strong sense of purpose in life. In Japan, it was being called ikigai. Then there was a different name in Italy about it. They downshift every day to relieve stress. So that is prioritizing stress relief. In certain communities, he found that they do not work very long hours. They work daily, but they prioritize time for themselves and their family members. 80% rule, stop eating when you are 80% full. Plant slant. Most of their diets were consisting of plant-based diet, more than 95%. So beans, whole grains, veggies, and fruits were the center. But actually, they were not calorie dense. When they were looking into the diet was not calorie dense. So all these communities, they were not taking so many calories inside. Belong, be a part of community or organization. Then loved one first. They had close friends and strong family connections. And right tribe, cultivate close friends with same values and strong social network. And they just did normal things, not that there were big gyms in these areas and people were taking gym membership. They were just naturally doing their work throughout the day, and they tend to use less gadgets, devices, and most of the work were done manually in these areas. So possibly as more and more higher urbanization, he has even gone back to the blue zones and then found out that the blue zones are actually shrinking in size now. Even in those areas, slowly the lifestyles have started changing. Coming to the summary, skin health for seniors, a good skincare routine, that is gentle cleansing, moisturizing, and photoprotective measures, sunscreening, along with a balanced diet, exercise, good sleep, a healthy weight maintenance would go a long way. And yes, avoiding smoking, stress relieving measures and cultivating resilience will help a lot. Be surrounded by loved ones, and in case of skin and systemic diseases, early diagnosis and good control would help a lot. Thank you for your patient hearing, and thank you, Senior, today and the team for inviting me.
Thank you very much, Dr. Singh, for this very detailed and excellent presentation. We have received quite a few questions already, some on the chat and some by WhatsApp, SMS to me. I will just start taking them. The first question is from Sharda Parvare. Can skin condition affect our body due to skin problems? Can we suffer from liver disease, anemia, autoimmune condition, and how can we take care of our skin after 70? I think the question is just you already answered it, but is there any specific thing that people should be looking for, after they've achieved the age of 70, after they've reached the age of 70?
Sir, one very important commonest is we are not able to take care of our skin. The dryness is happening as we all age. So we have to accept it and do a very gentle cleansing, and moisturizing becomes very important. And despite that moisturizing doing well, say 2-3 times a day one is doing, and if they are having itching, even they may not have a skin rash, but it's better than to meet a dermatologist. One is if you have a skin rash and some problem, then definitely it needs to be seen. But otherwise, just having an itching, there is nothing on the skin, but I am moisturizing well, then it is better to be seen, sir, because we need to evaluate them.
Right, thank you. We have two questions from Girija Ganesh. One is, what if one is allergic to sunscreen?
Sir, we have sunscreens which are chemical and physical and combination. So most likely the chemical sunscreen component may be the cause. So one can use physical sunscreens in that case.
All right. And an example of physical sunscreen, what would that be?
There are lots in the market, sir. I wouldn't want to take the
without a
brand
brand name.
names. Huh. Like things containing titanium dioxide, zinc oxide, like that kind of physical sunscreens.
Right. The second question which Girija Ganesh has said is, should seniors take vaccine for purpose? Is it the shingles vaccine? Is it, for all ages, or is it only for above, say, until 70 or 75? Can anybody take it?
Sir, it is approved for above 50 years. Above 50 years.
All right. This is a question from Shailaja Ganguly. Her question is, I've heard stress can cause skin issues. How true is this, and what is the treatment?
Actually, if we see, practically stress can worsen any disorder. The stress itself, it may be triggering some inflammatory cascades and all. But per se, we can't say that only stress has caused it. It's, say, someone has already a chronic skin disease. Stress can worsen it.
And Shashi Gulati asks about cirrhosis. I don't think there's any specific question about cirrhosis, but we have a question from Satish Kalia, who asks, suggest some common moisturizers. I think there's another question that I have got about moisturizers is, Doctor, I know you would not want to name a moisturizer, but is it a better thing to take a moisturizer which is, Ayurvedic, or is it a natural, or is it okay to even take one of the various moisturizers that are available from large companies?
So the usual moisturizers available can be used. One important thing is just look out for products which do not have too much of fragrance or perfumes. And once something is suiting, we don't change it very frequently. And now there are lots of big pharma brands which are available, and moisturizer for them is over the counter. So they have been advertising, I think, quite a lot. Some of them are very good. So.
This is a question from Shobha. The question is, ma'am, what is the treatment for hyperpigmentation, and what is the autoimmune process?
Sir, the treatment for hyperpigmentation will depend on what is causing it and what type of disease. So that needs an evaluation. But one thing is sure, one basic thing is they should use sunscreen then. They should use sunscreen and get evaluated what type of hyperpigmentation one is having. And the other second part is, sir, what is autoimmune?
Process.
Autoimmune process. Autoimmunity is something, say, our own body reacting against our own body parts. So that is called autoimmunity. Autoimmunity. So ideally, our immune system is supposed to protect us from outsiders. Anything which is outside our body and is perceived as a threat. But at some point, this gets confused and it's attacking our own body cells. That is called autoimmunity.
Doctor, we have a few questions that have come in about suggesting creams and anti-wrinkles treatment. What is your overall response to if somebody asks you for a moisturizer, and obviously you don't want to name a moisturizer, but what is it that one should look for in a moisturizer when one is buying? Because there are so many of them, and there are so many ads on television, there are so many ads on the internet, and they all are very fancily produced, and we don't really know where they are from, and they may well be international brands. And so what is it that one should look for, and what is it that one should be careful about?
Sir, moisturizer, we need two components. I can see some people have also mentioned about coconut oil and all. The coconut oil is, yes, it's good, but it has only one component of the moisturizer. That is the occlusive component, which it prevents the water getting lost from the skin. But then we also need some water getting and staying in the layers of the skin, which part is called a humectant. So there are occlusives, there are humectants in moisturizers. There are various things which can be taken as an occlusive, like coconut oil, liquid paraffin, they are occlusives. Then there are humectants available, which will draw in water from the atmosphere as well as the skin layers and keep the skin layers supple. So there are a lot of them. And sometimes over time, our skin structure, they are supposed to be lipid molecules also, when somewhere the structure tends to get broken. So some of them, they come and they mimic our natural skin, this thing like ceramides. So you will find a lot of moisturizers having ceramide, some having shea butter. So there are lots of other components along with it. If you prefer, practically, we look into that. Don't find something which has lots of other perfumes, because one tends to get sensitized sometimes. So that is a problem. So if the moisturizer is ceramide based, very good, because there are certain skin conditions we find it very difficult, especially eczema prone skin and all, we go for ceramide based moisturizers. Otherwise, the general moisturizers, most of them have both the components. That should be enough.
Doctor, I have another question which has come in. Doctor, there are quite a few Ayurvedic solutions that are there, and they they have a lot of natural ingredients that are in it. Are these also recommended to use? Because as far as oral drugs are concerned, there are some questions which are asked about Ayurvedic drugs.
Sir, in general, if we say coconut oil is one thing which does not react. It's very good to our skin, especially I would say cold pressed coconut oil. Or like certain eczema prone people, better they don't use the olive oil, because olive oil tends to not suit them. Rather, sometimes the eczema flares increases off. But unlike that, coconut oil is one thing which we can just okay, depending on no matter what, most of the time the coconut oil suits. So one possibility what people could do is, like when they get up in the morning and all, they can apply a cold pressed coconut oil. And after a couple of hours, as they take a bath, they can use a regular moisturizer after that. As far as these Ayurvedic stuffs with their internal composition is concerned, some may be fine, sir, but I will not have that much in detail knowledge about that. This thing comes in place when people use something and come with some kind of allergy or irritant reaction, or some kind of UV light allergy is coming, and I see them using that. At that point, I start thinking whether this is not suiting, or some of the ingredients is not going along well with them. And that's the time I ask to stop. Otherwise, if it is suiting them and not causing a problem, that's fine.
Right. We have a question from Mr. Lakshmi Narayan from Bangalore. His question is, part of the body is oily, but feet are dry. Is this common?
Yes, sir. It's common, as long as if there are any skin rashes on the feet, or any specific cuts or something is happening, then you need to see a dermatologist. Otherwise, make sure that at night at least the foot is well moisturized before we sleep.
The question which has come about that, doctor, the problem with moisturizing in the night is that if one gets up in the night to go to the washroom and it's all dark, one could slip. So is it a better thing to apply a moisturizer in the day, and so that at least if a surface is slippery, you don't slip and fall?
This becomes a problem with the feet and soles, sir. The feet also, if we apply excess moisturizer, invariably we can expect one to slip. So that is the reason we think of night because daytime everyone is walking and continuously moving. If one applies and just sitting, it restricts their mobility, especially sole and all if you are applying. If sleeping is a concern, we can wear cotton socks over it and sleep off in the night, and a cotton mat can be kept just by the side of the bed as we get down. But socks can be worn then.
Doctor, another question about, and I think we'll keep this as the last question on moisturizers. Doctor, what is your view about mustard oil, cold pressed mustard oil?
Cold press mustard oil. In eastern part of India, yes, a lot of mustard oil is used. So as long as it's not causing any problem to them, fine. I'll take it like this thing, but it may not suit everyone. So
it's almost a bit of a regional thing, right? In South,
yes. You see, South coconut oil is like everything. Mustard oil is only in the eastern India that it is used, and some swear by it. Their skin is very good with it. They feel very comfortable, and especially in winters, they get up in the morning, they apply it, and then after bath, they feel good. So it is like the oiling before bath. A lot of people use it, so it's suiting them. They can continue.
Right. Doctor, one last question. We are getting close to deadline. What would you suggest for dandruff? This is a question from Rajnikant Gilani, who says, I'm using anti-dandruff shampoo, but it does not make much of a difference.
So then I suggest you please meet a dermatologist. It needs an evaluation. Normally, the general dandruff, weekly 2 or 3 days, if you're just washing it properly, most of the time it should be fine. We should not allow that this thing to build up. Sometimes, but in old age, we don't expect your dandruff to be so much, sir. It's more of a problem of young. If the dandruff is continuing, it needs to be seen, sir, actually.
Doctor.
But yes, some people, they have dandruff in early ages, and then it settles by 30s and 40s, and then only to come back again after 60. So it needs to be seen.
Thank you very much, Dr. Nidhi Singh, for this detailed presentation. Those of you who are here, and please do note that this presentation will be edited and will be put up on the Seniors Today website by Monday evening. So please look up the website, that is seniorstoday.in, and we will have this presentation plus takeaways written by a medical practitioner, and that will be up on the Seniors Today website. Please refer to it, but there are obviously some references that have been made, and you will not have taken note of it, so you can watch the video again. Thank you all, and thank you to Dr. Nidhi Singh. Thank you to the team at Gleneagles for facilitating this. We will be back once again next Saturday, that is the 14th of September at 5 p.m. for another session of Health Live at Seniors Today. As you know, you can pre-register for the Health Live sessions. The login details, the links are there on the chat window. You can refer to that, and please also participate. Take the opportunity of participating in our various Evergreen Club sessions. They happen twice or thrice a day, and they are very enjoyable. Some of them are enjoyable. Some of them are very educative. Some of them are are good sessions on wellness. So you can take full advantage of that. Later this month, and very soon, we are going to be starting the 16th season of Seniors Have Talent. So if you or anybody around you who's 60 plus and likes singing, Bollywood singing, please take full advantage of it. We've had, as I mentioned, 15 seasons so far. So this is the 16th season, and take full advantage of our Seniors Have Talent event. We've had a lot of people who are there. I read out a question by Mr. Lakshmi. He was a season 1 member. I see a few others from our Seniors Have Talent alumni, if I might say, who are there here. So please, like them, you can also be part of the Seniors Today and Seniors Have Talent family. Thank you very much once again. We will be back with the Health Live at Seniors Today next Saturday at 5 p.m. Keep reading Seniors Today every day, Monday through Saturday. We have the newsletter coming every morning, and enjoy your festival season of Ganesh Chaturthi. Thank you very much.
Thank you, everyone. Thanks.
Subscribe now and press the bell icon. Never miss an update.